Hi, I'm Kerosene. Welcome to my prenatal Be Flexy. This class will help you alleviate some of the aches and pains that you may have experienced through any of the trimesters of your pregnancy. I'm a personal trainer and a certified pre- and postnatal fitness specialist. So these exercises are safe to do while you are pregnant and can be done at any time throughout your pregnancy. What you'll need is 2 blocks, a strap, and a water bottle. Let's start in a comfortable seated position, so however you like to sit. If that is cross-legged on the floor or on top of some blocks in a low squat. So I'll start in the seated squat position. In this position, I find I can have my back a little bit more upright, and it helps to have a deeper breath. So close your eyes and just notice your breath. Notice how you're breathing, the rhythm of your breath. Is it fast? Is it slow? And now try to deepen your breath. A long inhale through the nose and a long exhale. By breathing deeply, you'll be able to slow down your heart rate and start to relax. Place one hand on your belly and one hand on your chest. And as you breathe, feel the expansion of your belly, of your chest, and your collarbone. And as you exhale, feel the reverse. Bring your hands back onto your knees. Gently open the eyes. And while maintaining a deep and long breath, start to shake your head from side to side, like you're saying no. As you shift your head from one side to the other, that'll be in your inhale, and as you switch, exhale. Warming up the neck. Now shake it. Yes. So up and down. Inhale as you rise. Exhale as you bring it down. And relax the shoulders away from your ears. Sometimes I feel myself creeping up and creating tension. So you want to try relax and bring those shoulders down. And now let's do ear to shoulder. And half circles all the way down. And bring your head back to neutral. Let's start by bringing both knees on the ground. So we're kneeling down, but still sitting on our blocks. If it's comfortable for you, feel free to remove the blocks and just kneel on your heels. Now let's start to do big circles with the shoulders. And again, maintaining long, deep breaths throughout this whole practice. And switch directions. Bring the hands up and start to bring one hand down, circle it, opposite hand, big circles with the shoulders. And now switch directions. Let's try both arms at the same time. Warming up our shoulders, making sure that you're reaching full range of motion. And switch directions. Nice and controlled. Now let's bring the arms out in a T. Start by flipping one palm facing up and your opposite hand is facing down. So we're in external rotation with the palm facing up and internal rotation of the shoulder with the palm facing down. From here, let's alternate between having the palms up, palms down, and feeling that twist in the shoulder. So what I've noticed with my pregnancy is when I'm sleeping, especially, I sleep on my sides now because I can't sleep on my back. So I'm always curled up in a ball and my shoulders end up being in an internal rotation. So doing this exercise really helps to open up the opposite direction. So the opposite way in opening up the chest. So I'm always sleeping like this. The shoulders are rounded forward. Now this helps to open it the other way. All right, are you feeling your shoulders burn? I know I am. And from here, just start to reach above your head, side to side. And bring it back to neutral. Interlace your hands behind your back. Now stay in this position. I'll just move sideways so you can see what I'm doing. Here, and we'll do little lifts. So we'll squeeze the muscles, lift the hands off the back, and inhale to bring it back in. So exhale, inhale. And release. Move towards you again. Interlace your hands in the front, and now start to create some figure eights with your wrists. It's totally normal if you hear some snap, crackle, pops. As long as it's pain-free, it's fine. I don't know if you can hear it, but my wrists are cracking a lot. And now switch directions. There's always one direction that's ultra weird. I find this is really hard to get the movement. Now, bring your elbows out and start to create a wave-like shape with your arms. So as we do this, we feel the stretch in our fingers, in our wrists, the shoulders. And now switch directions, send the wave in the other way. The ocean doesn't do that, but we do. All right. Separate your hands. Bring your fingers out wide and stretch out your hand as much as possible. Create a fist. Now as tight as possible and open. In, out. In, out. And start to go a little bit faster with that squeeze. So we're engaging into a little ball and also engaging the fingers extended. You should start to feel a burn. And shake it out. All right, come onto all fours. Make sure that your shoulders are right above your wrists and your hips are above your knees. Take a deep breath in and drop into your cow pose. So arching the back, the belly comes down, and exhale, round like a cat. Inhale, and exhale. And now, as you round your back up in cat pose, try to squeeze your pelvis towards your rib cage so that you feel that engagement coming from your core. And squeeze. Inhale, release. Exhale, squeeze. Now from here, bring it back to neutral. Bring the knees out wide, feet touch, and drop back into child's pose. Bringing back up to tabletop, knees under the hips, curl the toes under, and press back into a downward dog. From here, pedal the heels and wiggle your tail. If your wrists are sensitive for this pose, I'll show you a different modification. So come down onto your forearms and press up into dolphin pose instead. And bring it back down. Find your child's pose for a little break. Grab some water if you need to. It's important to stay hydrated as you exercise. And let's meet in a seated pose. So your feet will come to the floor and go as wide as you need to with your legs. So if the belly's in the way, you can bring your feet closer. That's totally fine. And I will drop from one side to the other. So we're working on the internal and external rotation of the hips. And now let's bring it back to your left side. So sitting upright, your left leg will be in front of you in a 90-degree angle, and your right leg is pointing back, also in a 90-degree angle. So here we want to make sure there is a space between the foot and the knee. And from here, take a deep breath in, exhale, come forward towards the knee, the front knee. And with the belly in the way, we can go over the shin. And then over the foot. So rotating your body to fall right over that front foot. Now let's go over that space that's between your foot and your back knee. And start to bring it back over that foot. Just slowly pulsing up and down. Now over the shin. And back up. Let's switch sides. So your right leg will be in a nice 90 degrees in front of you and 90 for your back leg. Start by coming down and gently coming up. You might notice one side is a little bit more tight than the other. That's also very common. So for me, this is my good side. I feel like I can go a lot lower, but that just means I have to work on the other side a little extra. Now let's go over that foot. So this is helping us open up the hips, getting ready for birth. So we're working on our external rotation of the hip. And towards that space. And also the internal rotation of the back hip. Bring it back over that foot. And then over the shin. And back up to center. Come into a straddle position. So meaning both legs will be out. It doesn't have to be the max range of motion that you have. Still be legs at a 45-degree on each side. From here, flex the toes, and let's work on internally rotating the hip so the whole leg is coming inwards towards the midline. So this movement is coming from the hip, not from the feet or the knees. And then exhale, externally rotate towards the outside. And go with your own breath. So inhale in, exhale out. And now add your feet pointed and coming into doing a circle with your ankles as we're going inwards and outwards. So your ankles are getting a little bit of movement as well. And switch directions. Now your hands can be placed anywhere. I have them behind me for extra support. At the same time, I'm trying to maintain a neutral spine and sitting nice and upright. Again, there's probably going to be some crackling happening. That's totally fine. And just shake it out. Bring your legs into butterfly pose. So the knees are open wide and feet are together. From here, take a deep breath in and slowly exhale forward. Inhale, back up, and exhale, fold forward. And bring it back up to center. Now cross your legs, and from here grab your strap. So reach it maybe just a little bit past your shoulders on both sides. We'll raise it up. From here, pretend like you're pulling that strap apart, so maintain tension throughout this whole movement. And bring it back behind your head, squeezing the shoulder blades together. Try to rip that strap apart and back up. So inhale and exhale. Pull it down and squeeze. Inhale. Exhale, squeeze. It should burn at this point because we're engaging all the muscles. Squeeze everything in your back. And inhale, bring it back up. Now in this exercise, I'll just move sideways so you can see what I'm doing. So as I bring the strap down, I make sure that my head is not bobbing forward, that it's staying in line with the rest of my body. And the same thing with my rib cage. So we're not trying to flail the ribs open, we're trying to keep the ribs inwards. And feel free to grab anywhere on the strap, so whatever's comfortable for you. If you have a hair bun or a clip, the strap might get caught. That's okay. Do your best. Or squeeze those muscles extra hard to go beyond that range of motion. So this helps to open up the chest and work on all those back muscles to maintain a good posture, and also if you choose to breastfeed once baby has arrived, this helps to not always stay in an internal rotation with baby. So we're building up the muscles to help support that position. Now place your strap back down and let's meet in a tabletop position. From here, making sure that everything around here will be squeezing. So we'll be doing some fire hydrants with the legs. And if you're like me and developed a lot of pain, pelvic pain throughout this pregnancy, these exercises will help to strengthen the muscles so that the muscles can support your pelvis and alleviate some of that pain. So the fire hydrant looks like this. So from here, we start in our tabletop position, maintaining an active core and also making sure that the hips are staying leveled. So from here, lifting up the leg. Now we're not trying to lift as high as we can, just lift enough so you feel the muscle where your back pocket would be, that muscle is going to be engaged. And if you want to challenge, if you have the right positioning for your hips, place a block on top of your hips, and your block should stay balanced throughout this whole exercise. So we're not opening up the hip so that the block falls to the ground. We're keeping it all leveled. So 10 to 20 reps on each side is a good guideline to perform these exercises. Now let's do the other side. And again, if you have sore wrists, this can also be performed with the hands on blocks or forearms on blocks, and it still works the same muscles. Now bring it back to center, tabletop, and come into your wide knee child's pose for a little break. Notice how your hips feel, how your body feels. Remember to breathe deeply. And bring it back up to a comfortable seated position. Now let's give let's give our feet some love. So if you can, stack your legs one on top of the other. If that's uncomfortable, you can bring it one in front of the other, or even one leg straight and the other leg over your quad. Now from here, interlace your fingers in between your toes. If you've never done this before, it's going to feel very weird. And start to create some circles with your ankle. And switch directions. And now point and flex your ankle. And then bring both feet together in the front. Notice how one foot feels compared to the other. So mine feels all nice and warm. There's a little bit more blood flow. And let's switch sides. So interlace your hands, or your hand in your toes. and start to create nice and big circles with that ankle. And switch directions. Now point and flex the foot. And release. Grab your strap one more time. And wrap it around the heel of one foot. So from here, we'll bring that leg up and out to the side. And see if you can straighten and bend it down. So straight and down. Now with the strap, when your leg is straight, you should feel some tension in the back of your leg. And release when the knee's bent. So for those of you that might feel some sciatica happening, this is a great exercise to help with nerve pain. So this is a nerve flossing exercise. And the higher you reach the strap on your foot, the more you'll feel it. So adjust accordingly. And with your upper body, see if you can, again, maintain a neutral spine. So squeezing the shoulder blades together, and we're not rounding inwards this way. Use those newly made back muscles that we worked on earlier to help you support your posture. And now let's switch sides. And bring it up. Now the knee is coming a little bit like more towards the shoulder than straight on, because there's a thing in the way. And again, straighten and bend. And lean back a little bit too with the upper body. And bring it down. And now for the last part. If you are okay to be on your back, we'll turn onto the side and roll onto your back. From here, come into some hip bridges. So squeezing the glutes, squeezing the butt, squeezing your core. Take a deep breath in, and as you exhale, lift the hips up as high as you can. Inhale, bring it down. Exhale up, and make sure that our tailbone is tucking under as we lift up. Exhale, inhale. If you're not okay on your back, just skip these exercises and join us right after. Now stay up, bring the knees together, and open up the knees. So rolling onto the sides of your feet. Again, inhale, exhale, open. Inhale in, exhale, open. Start to feel the burn. Keep going. And relax it down. Now turn on to one side. Get comfortable. And we'll do some clamshells. So with the knees bent, bringing the hips stacked one on top of the other. Again, if you can reach your block, you can put your block behind you to make sure that we're not opening up the hip and rolling backwards. We want to maintain everything still and just the hips, or just the knee lifting up. So inhale, exhale, lift. Now the feet are staying together and the knee is lifting up. If this is too easy and you want to bring it up a notch, lift both feet up and do the same. And again, if this is too easy as well, see if you can lift both knees up and lift. So choose your difficulty option and do about 10 to 20 reps on each side. And let's switch sides. Again, from here, choose your difficulty level, whether that's everything on the floor, just the knee lifting, both feet off the floor, or both knees off the floor. And relax. Make yourself comfortable. We're done the hard part. Tap into your deep breaths. Close your eyes. And let your whole body melt into the floor. If you are comfortable on your back, you may position yourself on your back. If you're in your third trimester, lie down on your left side. Now if you are on your back, roll onto your side. And slowly make your way up to seated with your head relaxed the whole time. Until you are back in neutral. So let's finish off with some more deep breaths. Place one hand on your belly and the other hand on your chest. Close your eyes. As you feel your inhale, expand your belly, expand your ribs, expand your collarbone. And as you exhale, feel it drop down one at a time. Inhale, belly lifts, ribs, collarbone. Exhale, collarbone, ribs, belly. And do that a few more times on your own. Thank you so much for practicing with me. I hope you enjoyed this class. I hope your body feels much better than before. And feel free to do this class as many times as you need. It is safe for all 3 trimesters of your pregnancy. Please let me know in the comments if you have any feedback, and please hit subscribe. Thank you very much. I'm Kerosene.